My name is Greg Starling. I'm a general surgeon out at Mount Hood Medical Center. I'm part of the Legacy Medical Group, Mount Hood, general surgeon. I got into robotic surgery a couple of years ago, and at first I was very skeptical. I felt like, oh, this may be just a gimmick. It may be something that is more just to sell robots or something. And so I decided to investigate it for myself. And as I started learning about the technology and watching others around the country, I traveled around the country and watched others do surgeries. I started seeing it's not a robot that does the surgery. This is just a very advanced instrument in the hands of the surgeon. It allows the surgeon to do things that he can't do in a laparoscopic fashion. And so I got to be very excited about it. I started with a couple of procedures. Gallbladder procedures was something that I did very well laparoscopically, and so I picked it up. And we started to use the robot to do some of the gallbladder surgeries, and it went very well. And the patients had less pain than I felt like they did even laparoscopically. So the next thing I decided to try was doing inguinal hernias. And the inguinal hernias were something that I had struggled with. I did a good surgery, but my patients always came back with pain, and the pain lasted for months, and it was hard to get them through that, and it was frustrating to watch the patients struggle. They had minimal pain when the surgery started, and then they came back with more pain afterwards until they finally healed up. So I wanted to find a way to do the surgery better so that they would heal quicker. And I started doing it with robotics, and the robot would allow me to go into the abdomen and repair the hernia and use suture and other pieces of equipment to help the patient recover quicker. And what I was seeing was when they would come back to the office, their pain was minimal. Many of them took narcotic pain medicine for only a couple of days and then were not needing it after that. And so then I got to be excited about it. So I started to apply the robotics to many other things. I took it on from inguinal hernias to ventral hernias and umbilical hernias, and then I moved that on to doing colon resections. And the exciting part about doing the colon resections was many of my surgeries for colon resections were done in an open fashion. That meant you were making a large incision across the abdomen. And now I was able to do the same operation all on the inside through 5 or 6 little holes, where I was able to insert an instrument into these arms of the robot and then advance them into the patient, and then I was able to work through the instrument to do the same surgery I could do in an open fashion, but in a minimally invasive one inside the patient. And I could even remove the piece of their colon, hook it back together again, and do it all inside, and then make a very small incision, pull out the colon. The exciting part of that was patients who used to be in the hospital 5, 6, maybe even 10 days to recover from their colon surgery were now going home in 1 to 2 days or 3 days. And so they were having less pain, they were eating quicker, and back to their lives faster. And that's what got me really excited. From there, we've advanced on to do all types of colon operations, from benign diverticular disease to colon cancers, and also doing laparoscopic or robotic Nissen fundoplications for reflux and hiatal hernias. And that's been a huge advantage. Laparoscopically, it took us 4 hours, but doing it robotically, we've got that down to under 2 hours now. And the patients are going home the next day. And we're very excited about the advances that we're having with the robotics.